Hey, what's going on, guys? It's Brian Champlin, co-founder of We Like L.A. I'm back again for another episode of We Talk L.A. with the editor-in-chief of WeLikeLA.com, Juliet Bennet Rylah. Juliet, how are you doing today?
Good.
Good, and now fully ready to accept all the things that are now open this week, or more things that are open, per Mayor Garcetti's announcement on Tuesday, correct?
Yeah, a lot of things are open that weren't before just a week ago.
What are some of those things?
If you want to go to a store that's not a grocery store or a pharmacy, you may now do so. Bookstores, I just saw a board game shop that I used to go to before all of this, just reopened for retail. All sorts of stores. You can now go inside and choose your items. You will just have to practice physical distancing and wear a mask, and the stores have things that they have to do involving sanitation and signposting, etc. But that's something you can do now. Drive-in movie theaters can open up again. Libraries are open for pickup. Soon we're going to get salons and barber shops. So kind of a lot of things are now finally reopening. Of course, all of these things have the same modifications that we are used to with everything else: the physical distancing, the masks, the hand washing.
Right. And you mentioned salon. I mean, this is a question we get quite often through email or through comments on Facebook, is like, when are salons opening? When are gyms opening? And those two things are not part of the updated loosening of restrictions, but the outlook looks like it might be within the next few weeks, something like that.
It might even be sooner. Some counties are allowed to reopen salons and barber shops if they get a regional variance. Los Angeles has applied for that regional variance. It's very possible that you could drive to Riverside County and get a haircut right now. So we'll just have to wait and see how long it takes for LA to get its application in and how long it takes for the state to respond. And then it'll be how long it takes to get approval from the city of Los Angeles. And then it'll be how long it takes your stylist or your barber to make sure their shop is ready.
Yeah, we talked last week about LA possibly what criteria they were going to have to meet to apply for that variance. And I think you and I are both surprised how quickly they went and turned around and applied. I guess meaning that they met all the criteria, like that 8% infection rate over the course of X number of days. I think it was 2 weeks. We've hit that criteria then?
Yeah, it's 7 days, and I guess they did it, which is really surprising. In the beginning, when the variants first came out, it was just no way is LA ever going to meet it, because you had to have you couldn't have a single COVID-19 death in something like 14 days. And a lot of counties were saying, we may never meet that. That may go on for a really long time. So they loosened up the restrictions a little bit. And now one of the key criteria is to have a positivity rating of 8% or less, or a certain number of deaths over a certain amount of time per number of residents. The 8% positivity rating was the last thing on LA's list. That seemed to be the most difficult thing to meet. The last time we got an update, it was 9%, so we were very close. And then I guess we must have met it. It was something that surprised me too, and as someone who watches the press conferences every day, I was surprised that we got there.
Right.
But in terms of,
sorry, cut you off. Keep going.
In terms of the other metrics that don't involve those numbers at all, it's all about preparedness. And LA has done a very good job preparing and having enough contact tracers, and our testing capacity is huge. So it was already there in those metrics. It just had to get that positivity rating down, and apparently we've achieved that.
Yeah, and I want to correct myself from earlier. I said infection rate, and what I meant to say is the same thing, positivity rate. Positivity rate meaning out of all the people they tested, how many people tested positive, in other words,
Right.
not the total percentage of how much the county is infected by.
Right, and our infection, like the number of cases, goes up the more people we test, obviously, and then
Right.
the positivity rating, the percentage, can either go up or down, but it's been going down.
Right. Well, it is interesting to see how, they've sort of changed some of the criteria over time, and now we're also learning more things about what's going to be open in what stages. I know we reported earlier this week on when theme parks are going to be, and that's going to be in stage 3, which we haven't hit yet, but a lot of counties seem like they're about to move into or are already into. So we might see like Disneyland open in the near future or Universal, but obviously with different kinds of, it's going to be a different experience than you probably took on if you went like last summer or something like that.
Yeah, and that'll probably be later in stage 3. It probably won't be one of the first items to open back up. But we are seeing theme parks that are already open. Shanghai Disneyland is open now, and Florida is opening a couple of its theme parks in the next week or so.
Yeah, I think that'll be instructive too for, I mean, hopefully not in a bad way,
Yeah.
for other places that are waiting on it. So like Universal or something like that, where if there's a huge spike in infections that's based out of somebody going to visit one of those theme parks, I think that might give some reason for
Mhm.
pause or caution in terms of when they decide to open those up locally.
Yeah, and Universal especially, because Universal is opening its Orlando park, I think on June 5, and it'll be reduced capacity, mask wearing. I know in Shanghai Disneyland, they're checking people's temperature. Most of the rides and things are open. Everything has increased sanitation. The children's play area is closed, and any sort of interactive thing where people are just constantly touching it, they are not opening yet. But for Universal specifically, they'll be able to see what happens in Orlando and then maybe apply those same learnings to our park here if it turns out those learnings are not a disaster.
Yeah, it's hard to comprehend the amount of protocol, like the sheer quantity in terms of cleanliness protocol and things like that that's going to have to be applied to meet the standards that public health officials in whatever county these places are opening up in, it demands that they do. It got me thinking about like Las Vegas quote is supposedly opening
Yeah.
in the next week or something, and like what is the sanitation process look like for that, where I just can't even fathom that. It's not something I've researched or read into, but it does kind of boggle the mind to think about
Yeah.
how they think that's going to work with people, because it's very tactile kind of experience going into a casino and touching cards or knobs on a slot machine or doors, or just constantly everything is all in physical contact with each other. It's just weird to see how that's gonna fly.
Yeah. I mean, some places they've been advised to, if you can prop your door open or you can set your door to just be automatic, do that. Make sure people don't have to be touching things. In dine-in restaurants, one of the guidelines is give them single serving salt packets or whatever. Don't have people constantly touching condiment holders. And some of those things can be incorporated in Vegas, but I mean, I can only imagine they've got like a dedicated person who wipes down every single slot machine
Yeah,
after
that's
use. It's
that's
got to
what I
be,
was thinking too. That's exactly what I was thinking. Like, who's the
yeah.
person who has to go literally is swiping the same slot machine 500 times a day as they just cycle through, going
Mhm.
back and forth all these endless rows of slots. It does speak to the fact that we're all going to have to get used to a new normal, even as we get over our fears of going back out again, as we go to these places that were once
Mhm.
very familiar to us, and now having to sort of reacclimate ourselves, but with a different set of behaviors and protocols as we experience them. So like we have like virtually all of our hiking trails now are open again. Like even Runyon Canyon is opening back up again
Mhm.
this week. But what's
It's
that
open now.
experience going to be like? Yeah, it's open right now. So how are crowds mingling with each other, or going to the beach, or going to a museum when some of those open back up again? It's very strange, and I think people are going to be I don't know. There's going to be an adjustment period, I guess.
Yeah. And then I would advise people to adjust now, because I know there's been some pushback on some of these things. Some people don't want to wear masks, but I think this is going to go on for quite some time, and you might as well start now. I just got a letter yesterday from my building manager asking us to wear masks in the hallways and common areas, which I personally have been doing because I have the woman who lives next door to me is elderly. But I've seen a lot of people just kind of wandering around the hallways and chatting with each other and not wearing masks. And they've been putting increased signage up over the week. So we have one sign that says you have to keep the length of a cow in between you and everyone else. And there's like a little picture of a cow on it. But yesterday we got one that's like, you have to wear masks in the common area. So I guess I better get used to it. I think we all should.
Yeah, I think there's the one danger here would be that people get way too lax, assuming that like we've achieved victory in some way, when maybe this could be more of just a break for folks, until we actually have some sort of hard solution in hand, like a treatment or a vaccine or some of the things we talked about last week. But that said, I mean, like a lot of places are available now for outdoor recreation if Angelenos want to go experience them. And we've been writing, for weeks on indoor stuff. And we have another list that's coming out this week that's all stay-at-home type activities. But people have the option to go out now, and I think that's something that we're probably going to have to be writing about more. At least providing those options for people in the coming weeks.
Mm-hmm. Yeah, and I feel like if the health officials say that we can do it, and if you are willing to stay 6 feet apart and do all the things that you're supposed to, I guess I personally don't see a reason why you can't go to a botanical garden and wear your mask and stay 6 feet apart and take advantage of the hand washing stations. That's honestly probably safer than going to Ralph's. So
yeah, I have this weird, this is an interesting situation I was thinking about because Christina, my wife and other co-founder, she was out taking photos of the Jacaranda over Memorial Day weekend. And her big concern was, well, what if I have to like use a restroom? Like, when I'm out, like what if I have to pee? Where am I going to go and do that? And freaking out about that. And so she literally came home, drove back across the city after like being out for an hour and, came back here and then like went right back out. And thinking about that, I was like, well, what's the first time I use a public restroom going to be like? Am I going to have this weird phobia or is this going to have this tremendous sense of dis-ease or something like that? Because we've been infused with the suspicion that anybody could have the disease. Therefore, you need to protect yourself and base all your behavior on that assumption. And to let go of that assumption, I think will be difficult for a lot of people to let go of that fear that we've been, that sort of OCD that we've been trained as a good thing to maintain our health.
I think you're advised to keep it. I mean, they have, even yesterday, Dr. Ferrer was saying, you have to assume that anyone could have the virus, including you, and you just don't know. You haven't developed symptoms yet, or you're asymptomatic. So please continue to behave in this manner. Although I did read recently that public restrooms are already designed in such a way to minimize the spread of disease. For reasons I won't get into, but are obvious, there are certain bodily fluids that can spread disease. So if you can imagine that, restrooms are already set up to protect us from those things. So using a public restroom is actually probably pretty safe as long as you are not standing by other people. So if there's a line, you're spacing yourself out. And it's already a place where you're going to be washing your hands. So maybe use that opportunity to wash your hands a little extra. Make sure you stay away from people, wear your mask, and you should be fine.
Yeah, it's just, I guess, there's a bunch of factors, how small it is, who's in there, and so forth.
Yeah, it was a whole list of like, which bathrooms are safest. Is like a gas station bathroom that's outside safer than one that's in, like, yeah, there was a whole list of criteria about it.
Right. If it's like this, if your restroom's the size of a ballroom, that's fine. But if it's the size of a broom closet, then, that's a different ball game. Yeah, but I mean, people will be doing that. And I think that to Dr. Ferrer's point, and to kind of circle back to what I was trying to say, I think those two things are at odds though. Like the idea that we can maintain this permanent OCD behavior, but then expect that everybody's going to be coming back and using businesses and places that they were before. Those two forces are going to battle each other, the suspicion, but versus the inclination to go and use these things. And that'll be a story we're going to have to pay attention to over the coming weeks and months, like not just in LA, but around the country. It's like, what's the demand going to be like for services that are like more succinctly, just because places are open doesn't mean people will go back to and use them.
Yeah, I think everyone's going to have to make their own judgment calls. I'm in no hurry to get my hair cut or any of the personal grooming things. I feel like I can do that here. I miss my gym, but I'm also content doing that here. But I think where things for me would get a little tempting is the ability to maybe see other people that don't live in my house, and that's the point where I think for me it would have to be like, okay, well, what precautions are you taking, and how many other people do you see, and do you wear your mask when you go out, et cetera, things like that. So
Yeah, that's where that you had mentioned last week, we were talking about rapid testing. Like if we can get to that point, even if we don't have a cure or a great treatment for the disease, just being able to know like, okay, I could have 4 friends over to hang out and do like a mini dinner party because everybody can get tested that same day by some
yeah.
sort of take-home test. That would provide that would be a tremendous boost, and who knows how far that may be, if ever. But like something like that, short of a treatment or a vaccine, would be a pretty big help.
Mm-hmm. For sure.
Okay, well, it's a good update. Hopefully, people are taking advantage of these new things that are open, but also doing it safely and with the prescribed precautions from public health. I do appreciate your time, Juliet. As always, if you want some more at-home things to do, we have that list up on welikeLA.com. I'll throw it down in the description for this video on YouTube. But in the meantime, everybody out there, stay safe. You don't have to stay inside, but whatever you do, stay safe, stay healthy, and we will talk to you again soon. Take care.